Okay, so in this eye, what's very clear, obvious, okay, on the bowels. You see the bowels, right? It's a ascending colon. You see how yellow, orange it is, potential candida and sulfur. This is the transverse colon. You see how repressed it is. And here is the ascending colon. Look how dark and black it is. So chronic bowels. You have a thin ring going around. That's a malabsorption ring, indicates you're malabsorbed. You want to use the bowel cleanser and a bowel strength tincture. Maybe go on a lemon-only cleanse for 7 to 10 days, or even to cleanse it, the bowels properly. If you look closely, you see thick skin rings. See all here, that's skin ring. Indicates your thyroid is weak, kidneys are not filtering out waste properly. That color, that orange yellowish color, that 3D look to it, is lymph stagnation. You need to get kidneys filtered quickly, okay, and move the lymph system with herbs and fruit diet. You see those lines going round and round? Those are nerve rings. Indicates you have weak adrenals, weak nervous system, weak adrenals. Look at that line going around the bowels. Okay, that's autonomic nerve wreath. Indicates weak digestion or weak autonomic nervous system. Okay, often again due to weak adrenals. So you gotta clean the bowels. That dark line right there hits the neck and shoulder region. Okay, so you have potential neck and shoulder issues. You want to clean this up. Use the circulation tinctures. The heart is located right here. Look how dark it is right here. This heart. Yeah. Use the circulation tincture again to boost blood flow to this region. Here's the upper and lower lung region, also congested as well with lymph. And right here is where the thorax, ribs, and chest regions are located. You can see it's also congested of lymph. Use the respiratory T and the respiratory 1 tincture. See, this section right here is where the spleen, okay, and the left arm and hands are located. The spleen especially needs some work. Use the spleen tincture. So this is the most disturbing part. You see this dark spot here, your adrenals. Okay, you see chronic adrenals. When you see it like this, it's a crypt. It's lack of energy flow going in and out of the cell. You start experiencing anxiety, tiredness, poor nervous system issues. And look at the kidneys right here as well, also chronic as well. Use the kidney tincture, use the adrenal tincture. You need to work on this quickly. The entire back region is also congested as well, okay? So you want to detox that. This dark spot here hits the scapular region. The esophagus is right here, and the voice box also right here. So you want to fix that. You want to use respiratory T and respiratory 1 tincture and 100% fruit diet. And you got a very heavy sinus congestion. That dark line right there hits the eyes, okay, and the forehead region. And this dark line right here hits the nose, okay, and the lower jaw region. Your sinuses are congested. You need to detox that. You need to use a neti pot with essential oils, eye washes, ear candling, anything you can do to help break the congestion there, because it's getting chronic. Okay, you don't want you end up getting eye issues quickly. And this dark spot right here, that's pineal gland. Okay, so you're gonna have sleep issues arising soon, if not already. So use a sleep tincture if you do have sleep issues. Otherwise, use an endocrine tincture. And right here is where the pituitary gland region is located. You can see it's also chronic as well. So if this gland goes down, all the other endocrine glands go down as well. They get weaker. So make sure you use endocrine tincture, okay, to address this. Overall, this eye has quite a bit of lymph stagnation, weak kidneys, bowels are very pressing, congestion in the brain section right here, hand, scalp region also congested, thyroid is weak, you need to address the thyroid, you have nerve rings, address the adrenals and kidneys, and give it time, because it's going to take a little bit of time. This is quite deep, it's taking quite a bit of time. So be patient, embrace the lifestyle, and do your best. And you see the inflammation right here on the sclera, the white, that shows high acidosis. And when it's to the brown side a bit, yellowish brown, that shows potential liver issues as well. And you definitely have potential candida and sulfur.